Those who work outdoors should definitely be concerned about their sun exposure, because oftentimes they're going to be outside during the peak burn hours between 10 a.m. and 4 p.m. when the sun's rays are more intense and the risk of sunburn is greatest. People who work at higher altitudes where the radiation is stronger are also at higher risk. A study has shown that pilots and their crew have double the rate of melanoma compared to their peers. First and foremost, sunscreen. Just use it. It should become part of a daily habit. Before you go outside to work, broad spectrum sunscreen, SPF 30. Broad spectrum means it will protect you against UVA as well as UVB. Preferably it should say water resistant to 80 minutes. And it's important to put enough sunscreen on. One shot glass full, which is an ounce of sunscreen, is what's required to cover the exposed areas of the body. The second thing, of course, is sun protective clothing. Try to choose loose fitting, comfortable, long sleeves, long pants, UV filtering sunglasses. Hats, wide-brimmed hats are important. They're preferable because they will block or help protect you from sun exposure on the back of the neck, as well as the ears. Sun exposure is basically equivalent to radiation to the skin. And signs of radiation damage to the skin can include accelerated aging of the skin, discoloration of the skin, wrinkles, cataracts, skin fragility, which can lead to easy bruising, and of course the most important is the DNA damage that will cause mutations leading to skin cancer, of which we are most concerned with basal cell skin cancer, squamous cell skin cancer, and melanoma. Melanoma is the uncontrolled growth of the pigment-making cells called melanocytes in your skin. And it is a more worrisome form of skin cancer because it can be aggressive and it has the ability to spread and be deadly. The best defense is early detection, and that leads to much higher cure rates. Because melanoma can occur on non-sun exposed skin, it's actually very important to get into the habit of performing regular skin self-exams. We encourage people to try to do this every 1 to 2 months so that you will recognize when there's a change in your skin. If you should see an existing mole changing or a new mole appears that looks different from the others, we sometimes call that the ugly duckling sign, that would be significant. If a mole is itching, if it's bleeding, if it's scabbing, that's significant as well. And melanoma has higher cure rates when detected early, so that's your best defense. If you have a concerning area, we encourage you to seek help from a dermatologist who will perform a thorough skin exam and may take a tissue sample called a biopsy of any suspicious lesions. And that will get sent to the lab for analysis. Melanoma incidence is on the rise. It's actually estimated that in 2015, 1 in 50 Americans will develop melanoma in their lifetime, and for skin cancer in general, 1 in 5. We talk about safety in the workplace. If you work at a construction site, you're going to wear a hard hat. If you're a welder, you'd have a protective mask on. If you're a healthcare provider, you wouldn't handle blood products without protective gloves. If the sun, the outdoors, is your workplace, you need to treat it the same way and protect your skin with the sun protective clothing and sunscreen. Doing that now is an investment in your future.